Dr. Theresa Tam, Canada's Chief Public Health Officer, welcome to HFX 2020.
It's great to be with you.
It's a pleasure to have you, although in a certain sense, and you must get this kind of sort of paradoxical kind of compliment all the time. It's a sign of the times and a very sad statement on the times that people such as yourself are now so prominent and their role is so important. It's always important, but particularly when we have a major health crisis on our hands. I wonder if you could start off by just telling us how things are looking right now in Canada. I mean, obviously, there is 2 new vaccines everybody's talking about from Pfizer and Moderna. What is the state of play in Canada? How are you looking at things right now and with a sort of 3 to 6 month perspective?
Well, I think Canada actually did quite well in the what we call sort of planking the first wave. So I think we had a huge amount of collaboration, whether it's in society, communities, but also all levels of government. So I think then we went into the sort of summer months where some of the public health measures or more restrictive measures did sort of relax, and people having followed weeks and weeks of these public health directives began to relax as well. And certainly as we moved into the sort of fall season, our numbers of cases have escalated. And so we are into this fall resurgence, which is actually quite concerning because everywhere outside of what we call the Atlantic region or the Atlantic bubble, where the conference would have taken place, and up until very recently, the territories, the provinces are all experiencing some level of resurgence. Much of it in the urban centers, but more concerning is that it's actually dissipating into the more remote communities. And a very concerning development just this week is community transmission in Nunavut, which is a territory to the north, which has many more remote communities. So with a growth of about 4,500 cases a day, we're projecting that if we didn't do something fast and to suppress the current resurgence, we could be looking at 10,000 cases per day by December. So there's much effort across the country, but done more at the local and provincial level for looking at more targeted measures to suppress the transmission. So from an epidemiologic perspective, that's where we're at. I think, like many countries, we have learned a lot about the virus, a bit more about how you better manage clinically patients and the ICU management, the steroids, dexamethasone that we can provide. And we have increased public health capacity in testing, contact tracing, isolation measures, but clearly not enough because we are seeing this resurgence. So there's a renewed effort required to get things more under control.
Just on that point, I mean, everybody, of course, is absolutely fascinated by this whole question of the way that care and just the frontline medical, the application of medicine to people who have the illness. I mean, back in March, the doctors and the nurses just didn't know what they were dealing with. I mean, it was a completely new virus. I mean, there have been coronaviruses before, but this one was a new one. Is it the case that by now, where are we, sort of 9 months after most of the world, certainly Europe, perhaps in North America, it was a little bit later, that once people have been admitted to hospital, are in ICUs and in the worst and most dangerous cases are on ventilators, are they recovering at a greater rate than they did 9 months ago?
I think 9 months ago, the first wave, Canada's impact was most felt in the old age groups. And our mortality And even now, it's really related to people who are over the age of 70 in general, vast majority. But there are some younger persons who've been admitted to the hospital and the ICU. In general, the reports are that, there's much has been learned about the virus and what kind of illness is pathology. What does it cause in the body? So it's not just a respiratory illness, but many other systems are involved. Some of it related to inflammation, your body's reaction, and its immunological reaction rather than the virus itself. So with an increase in understanding of the underlying pathogenesis, if you like, the treatments then became improved, whether it's the way you ventilate a patient, the application of steroids for inflammation. In general, what I'm hearing is that ICU stays might be a bit shorter, for example. And so, but I do think a lot of it is related to you have older age groups that already have underlying medical conditions, and it's really tough. So prevention is really key in that front. But we have learned a lot. Now, interestingly, of course, there's been global efforts in trying to do clinical trials in looking at treatments, and we'll talk about vaccines in a minute. But a lot of the sort of existing antivirals didn't really perform that well. So the existing antibiotics or antimicrobials, for against the virus, or the antimicrobials that may have a more general effect, didn't really perform great. We do have remdesivir, which is an antiviral that has been repurposed, if you like. That it has been approved through interim orders or emergency use in some countries. But again, I think the impact is not as great as we would like to see. So there are more sort of designer drugs, if you like, that one might see. There's what we call monoclonal antibodies that are coming online as well. So far looking like they might be more effective, as one might expect in the early stages of the illness before the body generates antibodies. So still, if we can suppress the virus and buy more time, there will be more, I think, treatment options.
Right, and of course the ultimate solution is like the famous first rule of seamanship: don't get yourself into the problem in the first place. And the best way to do that, of course, is to have a vaccine. Now we've got these two vaccines that everyone's talking about: the Pfizer vaccine, which is claimed to be 90% effective, and the Moderna vaccine, which was claimed, I believe, to be 94.5% effective. In terms of taking a sort of 6-month perspective, I mean, I was watching earlier this week Alex Azar, the US Health Secretary, and he laid out in sort of embryonic sort of terms a plan which would envisage being able to treat, to vaccinate the higher risk groups through December and January, and then frontline workers after that, and then getting to the whole population by the spring, by the sort of April time. In terms of a rollout of a vaccine, is that kind of timeline, whether for the United States or Canada or any other advanced country, is that realistic? I mean, we'd all like it to be realistic, but is it?
Well, I think what's been one of the most remarkable things that have happened during this pandemic is the global collaboration, research and development. We've never seen anything like it. So, and that has resulted in the discovery and then the clinical trials of a number of vaccines. As I believe last time I looked, approximately 13 vaccines are in phase 3 clinical trials, which are the more advanced trials where you look at safety and effectiveness in tens of thousands of people. So many of those are sort of at play right now, which is great for the fact that we've only seen this virus practically for like 10 months. So many people have said, well, we've compressed 10 years into 10 months in terms of our efforts. The news coming out of Pfizer and Moderna is a good soundbite, if you like. We still obviously have to see the actual data, and there's an interim sort of reporting out, but it's definitely giving us a lot of hope for a whole host of reasons, because of the reported 90% or over efficacy, and we expect the safety data to come along soon. And so some of the pre-planning, if you like, that has been done includes, of course, actually investing in a wide portfolio of vaccines. From a Canadian perspective, that makes sense domestically, but it also supports the global vaccine platforms that we've invested in at least seven different vaccines.
May I just interject here, because it's a very interesting question to non-Americans. That I live in the United States and I watch the United States news channels, and the two drugs that were or the two drug companies that purportedly come out with the vaccines, and there's still a mystery to me, because this may well apply to the United States, that they can roll this out in the next 6 months or so, but there's only a limited amount of drugs that pharmaceutical companies can manufacture. So our countries outside the United States, and Canada would be a perfect illustration, are those of us who are not American, or those people in the rest of the world who are not living in America, going to be able to get these vaccines as fast as the Americans can?
Well, there's no doubt that there's a limited supply at the beginning. And so we have to make sure that everybody is aware of that. I don't think there's a huge amount of certainty, given that we're still in phase 3 clinical trial, as to the exact amount rolling out on a certain date. But from a Canadian perspective, we are planning with the hopes that we'll get something within the first quarter of 2021. And so much is activities going on right now to plan on that kind of timeline. Within the Canadian context, we have in agreements, as I said, with 7 different companies, because we don't really know how they will all pan out. But our aim is that within the next year, 2021, we would like to be able to provide every Canadian who wants to be vaccinated with the vaccine. And for the most part, most of the vaccines require 2 doses as well. So, you've got to multiply your population by 2, and then look at the really details of the rollout using different scenarios. Because we don't have a great deal of certainty, what we're trying to do now is, well, if we had X amount of vaccine, who would get prioritized first? So I know there's similar exercises within other countries. So in Canada, we have a National Advisory Committee on Immunization. Not surprisingly, prioritizing healthcare workers, essential workers, those at higher risk, and those whose working or living conditions put them at high risk. So then with a more precision on the amount available by different companies, then you have to map out, well, exactly which population can be covered, because we know the size of roughly of those populations. And then Canada is a big country with very varied challenges in the sort of logistical operational delivery of some of these vaccines. I think many people have heard that the Pfizer vaccine is an ultra cold chain storage sort of requirements, and the Moderna at -20, and the Moderna vaccine. So, and other vaccines to come have a more regular fridge sort of temperature stability. So all of these factors have to take into account as we do that very complex logistical planning as well. So it's touted to be one of the most complex operational, undertakings that anyone has ever taken, at least in the area of public health vaccination. And so, making the link to the security sector, of course, we will leverage the logistical expertise of our Canadian Armed Forces and others, private sector, the manufacturers, people who do these logistical cold chains, all of them have to come together and are coming together in order to make this a reality. So you can imagine every step a certain number of uncertainties. So, we plan for the shortest timeline at which the vaccine might become available, but we always have to sort of recalibrate.
It's interesting you mentioned, because I remember earlier in the year, and you will of course remember it too, that there was a certain amount of controversy about there's always controversy surrounding anything President Trump says, but he was talking about using the United States military as the obvious place to go to get this vaccine distributed. And it's interesting you mentioned that obviously in a country as vast as Canada, but in any country, getting out, simply logistically getting the vaccine to the whole population is something that is an extraordinary feat and requires organizations perhaps like the military that are used to thinking in this big sort of scale. But even if we employ all the resources of society, including the military, there is of course one problem, which is in free societies we're not allowed to force people to take a vaccine. There was a poll out today or there was a poll out this week on CBS News saying that 58% of Americans would take one of the vaccines, but 42% wouldn't. Now, maybe over time that 42% goes down, but it's a lot of people who right now feel very cynical about vaccines and say they don't want to take it. Are you seeing that kind of problem also in Canada? And if so, how does one overcome that problem?
Well, I think what you've asked is a very important aspect of the pandemic vaccine rollout and our strategic considerations. So we've done, of course, similar check-ins over time with the population to see how many of them would take the vaccine. And, the vast majority of Canadians do say that they would get the vaccine once available. Amongst them, though, some of them are a bit different. So some might say, yes, we would, but we will defer till a bit later. And others are just wanting to know a bit more. They want to ask questions. They're a bit hesitant because they still feel that, there's some unknowns. And so what we've characterized is what we call the movable middle, the group in the middle that haven't made up their minds one way or the other. So that we can target and make sure our communications, our messaging, and our public education takes care of their needs. So there's a number of key considerations. Obviously, using behavioral insights to inform the type of communications that we need. One interesting fact is that, of course, with this unprecedented speed at which these vaccines are developed, and some of them are quite novel platforms, people have questions about, are they safe? So one key aspect is to provide people with information about our very robust clinical trial and regulatory requirements in Canada, and bringing the public along in terms of how do we make sure that we have safety information and efficacy information and what we might call operational transparency. So making sure that that is obvious, and we need to do more of that. In behavioral sort of insights, we know that testimonials work when people listen to others and know how impactful COVID-19 has been in their lives. And there are influences that people listen to, not me necessarily, but other influences, parent influences, youth influences, other influences that we need to leverage to get more of these messages out. So I think many countries are sort of looking at that. We have also, I think the WHO called vaccine confidence one of the top 10 global health challenges. So globally, there is a networking of people who've been looking at the challenges in this field and sort of think about what more can we do to boost vaccine confidence. Some of the ideas, obviously having a great insight, and here's where other intelligence sectors might help too. We are looking at first pandemic in a truly social media internet age. where there's a lot of mis and disinformation, like actual disinformation about all sorts of things during this pandemic. And we need to use certain techniques to sort of not just to rebuke or to crowd out misleading narratives, but I think I'm interested in the prevention aspects. So the concept of sort of a technique of getting to people to teach them and get them more educated about how they're being sort of misled ahead of time, the kind of techniques that they may be subjected to, whether it's conspiracy theories, check those experts because they may be fake experts, how people are selectively pulling, cherry picking bits of information to put in front of people, the algorithms and the bots that are at work behind what they're reading, people setting unrealistic expectations. Say for a vaccine, they say, well, if it's not 100% safe, well, nothing, maybe that we should question it, when of course nothing is 100% safe and effective, and we need to be transparent about it. And the false logic, in the vaccine world, I think that one of the greatest demonstrations of misinformation, false logic, is MMR and autism.
Yeah.
And even after that is being debunked for so long, it still sticks in people's memories, and they still doubt, measles vaccination. And so we know that preempting is one technique that we perhaps need to do more of. So there's a number of, ways that we can do a lot more of that. I know that in many other sectors, it's playing out in the United States right now is, what's the role of the internet and social media companies? What is their responsibility? How should they also work? Because if there's a dissemination of mis and disinformation, it could cost lives.
Yeah. So
I think working with them, and we have been working with different internet companies to try and see what role they can play in this space.
You spoke about vaccine confidence, and we've talked about the way the public perceives health matters and therefore its readiness to accept a vaccine and to reject disinformation. That also speaks to the wider question, which is a tough one to answer. But I guess, like anything else, we want to learn from our mistakes so that we're better prepared if there are, even when, I suppose, there is a new virus that comes along. Were we really unprepared? I mean, obviously with hindsight we can be wise about anything, but were we really unprepared? When the economic pain really hits, which a lot of economists project is still to come, will the public be right to be angry with governments for not being better prepared? Or is that a little bit sort of wishful thinking? I mean, obviously we could have had more in the way of testing facilities available, but was there ultimately a lot we could have done to make this situation better?
Well, I think, we do have to step back and look at what happened, and there'll be tremendous amount of lessons learned, I'm sure. But we haven't encountered an event of this magnitude in the public health space for like 100 years. So it is something that is, I think beyond the blueprints that we have in front of us, or we had in front of us, and spurs us into thinking, well, what will we do next in the future? Because you can sort of keep looking back, but the key is, well, so what are you going to do differently going forwards? And so I think that's really important. Now, what the pandemic, I think, has shown us is that it was a really humbling experience for many countries who would be classified as a developed country with quite a lot of resources. And we work a lot with our G7 partners and continues to work with them on pandemic preparedness. And so when we look at those countries, many of them have been severely impacted, whereas other countries who may be in the middle and lower income countries have done better. So how do we translate some of this knowledge? I think being open to learning and being humble about what we were not able to do is really important. You said at the beginning that, it's actually quite good that people don't see chief medical officers on a daily basis, because when you do, it's likely that something quite extraordinary is happening, because we prevent things from happening. So prevention, health promotion, and keeping our public health capacity is really critical. But we are often impacted by what I call the sort of boom and bust cycle. So once you've had an emergency, people remember that it's actually important to invest in public health. And then a couple of years later, due to all sorts of other pressures, for example, economic and other pressures maybe, people start scaling back on some of those investments, which is probably not a very good idea. Because for a number of reasons. One is that I expect this type of emergence of new pathogens and other public health threats to become more frequent and not less frequent. And so for a whole host of reasons in terms of, how humans and animals are interfacing more frequently, these massive volumes and speed of global travel, our food chains being globalized, climate change, all of these really complex factors will very likely result in more and more of these sort of situations from happening. And so some of the moving forwards, and I just sort of did an annual report on this and suggested three key things moving forwards. One is a truly multi-sectoral pandemic preparedness, and having your plan, which is not a health plan, but a whole government, whole sector plan that includes all your social and economic support departments, your finance department, your housing departments, working with health, because public health is a tiny aspect of our capacity. Exercise those plans, frequently. Also, do whatever we can to improve communication and engender societal cohesion and trust, because that is so critical for success. And thirdly, there is this public health capacity investment. And so we will learn, and people will say, well, you didn't do enough of X, Y, and Z. There's not enough stockpiles over here, or there's not enough measures at the border or testing. So what we're going to do about it? We need to come out of this pandemic leveraging on these vaccine platforms, on the sort of renaissance and support for rapid testing, for example, so that we don't forget when the next thing comes along. And the other thing is really building resiliency in our communities. In Canada, the most devastating impacts on our most vulnerable populations. And I can guarantee that the next pandemic is going to hit the same vulnerable populations, where it could be seniors, but certainly people maybe in lower socioeconomic conditions, crowded housing, low-paying jobs, marginalized, stigmatized, racialized populations. If we don't support them in the inter-pandemic period, the next time is that they will be disproportionately impacted. I propose that health equity be built into pandemic planning, response, and recovery. So, because what happens to every single person in society affects others. And so this concept of no one's protected until everyone's protected has to permeate through the whole cycle of emergency management, and will really show us whether we've learned anything for the next pandemic to come.
That's a very interesting way to conclude that we often talk about the social consequences of a health emergency, a pandemic like COVID-19. But it's also true in reverse, that the way we organise society can itself impact how successfully we get out of these problems. Dr. Theresa Tam, Canada's Chief Public Health Officer, this has been an education, and it's been a delight to have you at HFX 2020. Thank you very much.
Thank you for this opportunity, and all the best for the rest of the conference. Thank you.
Thank you.